Pause the video as necessary for your viewing. These are some of the most common reasons a patient is disconnected from a mechanical ventilator. At present, there are only two solutions available to hospitals for maintaining a closed circuit. They are the delivery of inhaled medication and inline closed suction systems. Although circuit disconnections are thought of as brief or infrequent, this is a quick example of an intubated patient arriving to the emergency room. As you can see, to implement therapy and transport the patient, there are several circuit disconnections putting patients' lungs at risk of injury from collapse and re-expansion, as well as exposure of the clinician to airborne pathogens. Flusso works off the principle of pressure 1 is greater than pressure 2. For example, the patient on the left is receiving gas from a stationary ventilator through the ventilator port. This would mean that the bypass port is closed. Ventilator port pressure is greater than bypass port pressure. Let's have a look at the patient on the right. If the clinician had to transition therapy or transport the patient, they would uncap the bypass port, attach and activate the transport system, i.e. the resuscitation bag with PEEP valve or transport ventilator, then turn off or put the stationary ventilator into standby. At this point, the patient would be ventilated through the bypass port and the ventilator port would be closed. The use of Flusso is done in 3 simple steps. Number 1. As gas flows through the ventilator port to the patient, hold the Flusso device in your hand. Number 2. Uncap the bypass port. Attach and activate the transportation system. For example, squeeze your resuscitation bag with PEEP valve or turn on your transport vent. Number 3. Put your stationary ventilator in standby mode or turn it off. This instantly activates the swing valve within Flusso. At this point, you can safely disconnect your circuit and transition the patient therapy, i.e. change HME, or transport the patient, always ensuring to cap the ventilator port. The ventilator circuit is divided into 2 sections, patient side and machine side. The patient side includes inline suction, optional corrugated tubing, and Flusso. These items will always remain with the patient even during transport. The machine side consists of all devices that will remain with the stationary ventilator. This also includes specific items like flow sensors and HMEs. Let us have a look at what current therapy is and how Flusso is implemented at the patient bedside. Staff safety is a crucial part of our healthcare system. A reminder that there are 2 sides to every disconnection, active end and passive end. The ventilator should always be put into standby mode, or turned off, as the flow from the ventilator would disperse particles from within the ventilator circuit around the room. Alongside that, even if the ventilator is put into standby, there is still passive exhalation from the patient that could expose staff to airborne contaminants. In a recent study completed by the Aerospace Engineering Department at Carleton University, it was found that following the current standard procedures for patient transportation with a 3-circuit disconnection, a leakage instantly of 25% to a peak of 46% of particles emanating. These measurements were of nitric oxide. However, this could be extrapolated to be bacteria, virus, or pharmaceutical aerosols. In a recent study from the Hospital for Sick Children in Toronto, Canada, they reviewed the impact of ventilator disconnection. Their conclusion was abrupt deflation after sustained inflation can cause acute lung injury. This study showed a dramatic increase in mean arterial pressure upon ventilator circuit disconnection, alongside serious cardiac events shown by echocardiography. Based on current therapy, there are 2 solutions for hospitals to reduce circuit disconnects. By adding the Flusso By Pass Adapter to your current practice, clinicians can increase that to 18 different solutions, reducing circuit disconnects dramatically. Let us review the Flusso By Pass Adapter. Bypass port. Patient port. And ventilator port. What is the intended use for the Flusso By Pass Adapter? A. To maintain a closed circuit. B. Manual resuscitation. Or C. Medication delivery. The correct answer is to maintain a closed circuit. What is the configuration of setup for a ventilated patient? A. Ventilator circuit. Flusso, optional flex tube, inline suction, and ETT. B. Flusso, ventilator circuit, inline suction, ETT. Or C. Flusso on inspiratory limb of ventilator circuit, flex tube, inline suction, and ETT. The correct answer is ventilator circuit, then Flusso, optional flex tube, then inline suction, and lastly ETT. What is the patient transport sequence using Flusso? Take a moment to read each possible answer, and then make your selection. The correct answer is B. Attach and activate the transport ventilator or resuscitation bag with PEEP valve to the bypass port. Turn off the main ventilator, and then disconnect the circuit from the ventilator port. To reconnect to the stationary ventilator, reverse the procedure. Using the tethered dust cap, ensure to cap the port that is not in use. What is the proper procedure to change an HME or ventilator filter or add medication delivery device using Flusso? Take a moment to read each possible answer and then make your selection. The correct answer is A. Attach resuscitation bag with PEEP valve to bypass port. Squeeze bag twice to activate. Turn off main ventilator. Disconnect circuit from ventilator port. Change HME or filter, or implement drug delivery device. Attach and activate main ventilator to ventilator port. When finished, cap bypass port using tethered dust cap provided. Flusso can be used to maintain a closed circuit for the following procedures. What are they? All of them are correct. All items therapies listed below. The benefits of maintaining a closed ventilator circuit are what? The correct answer is all of them. All items therapies listed below.